The Dermalive gel that is injected forms cysts, and these are benign cysts that we have surgically removed from our client's face. The best approach for treating Dermalive gel is to remove these gels intact so that nothing remains of them. However, the method we see colleagues performing more often is that they come and suction a portion of the Dermalive gel, or they go inside with a cannula and try to drain it using negative pressure. We can see this cyst right now. If it were in the face, we wouldn't be able to see it this clearly. It is completely surrounded by complex tissues, and unfortunately we do not exactly know what its precise depth and total volume are like at this stage. Now let us assume that this here is the cannula, and our colleagues are looking to drain this specific gel using either a standard syringe or a suction device to clear the area effectively. You see that the consistency of that gel is such that it doesn't get drawn out easily with a syringe. See, it doesn't get drawn out with a syringe. It didn't get drawn out at all. Well, in these specific situations, they are often forced to use larger needles or cannulas. So what we are going to do is use a larger needle ourselves, and then we will carefully test it out this time to ensure it works. See, even though the needle is inside, it cannot draw out all the material. This material is thick and it clots inside the needle itself. This is the same thing that happens to you. Now, no matter how much I move my needle back and forth, let's assume it's a cannula, some parts of this gel get drained, but look, the amount that remains is significant. You can see in the syringe that parts of the gel are being drained. But what about the part of that gel that remains in your face? What is going to happen to that? What will actually become of it? The part that remains in your face will continue to stay as a cyst, and if we try to remove it by applying pressure, this cyst might rupture again, and the cyst contents could spread to the surrounding tissues. This is completely blocked. Look, the Paag gel, it has unfortunately become completely blocked. Now listen closely. If this cyst were to rupture, the Paag gel would inevitably spread out into the surrounding areas and infiltrate other healthy tissues. This would then lead to the formation of multiple smaller and more problematic cysts developing all around the original site. So if it was one large cyst, when this large cyst ruptures, it turns into several smaller cysts, and these will have a lot of fibrous tissue around them. So what happens is that instead of being able to easily drain this gel, we are forced to drain several other cysts. And furthermore, fibrous tissues will form in your face, which will permanently destroy the softness and smoothness of your face. I mean, for those of you who are looking to drain the gel by pressing on it, right now this gel, this sac or our cyst, is actually torn in one specific part. It is quite delicate. But for colleagues who insert a needle or make an incision and want to press to drain this gel, parts of this gel will be drained, but this gel, its sac might tear, and as it comes out, it can spread to the surrounding tissues, and we see that when it goes into the surrounding tissues, it creates a cyst itself. In the best case scenario, assuming all this gel is drained, look again, I pressed here, it opened up somewhere else, and the gel is coming out from another spot. So some parts came out from that side, and some parts are coming out from somewhere else. Meaning, in the best case scenario, you see that it tears from different points, and the gel that comes out, we can be sure that some parts of the gel will remain there as a cyst. This cyst will ultimately remain in your face. If you inject gel, it might go into this cyst and create a new cyst itself. If you inject fat, the fat that goes inside this cyst won't survive. It breaks down and creates what is technically called an oil cyst. So the best case is for this Paget's gel to be removed directly through surgery, and we should completely remove even the cyst wall from your face.